My name is Letisha Whyte and I'm the first contact podiatrist for Brierley Hill and Amblecote PCN. I've been in my role since February 2021. I came from the private sector, but prior to that I was in secondary care. I think for me it's working within the wider MDT. Coming from the private sector and the community sector, it's very rare that I would have access to all these different clinicians, and also rare that I'd see a GP face to face. Often it's over the phone. So I think it's nice to be able to build these relationships face to face. If patients have concerns, I can go and speak to lots of different specialities. I can speak to the physiotherapist, I can speak to the OT, I can speak to the practice nurse, and it's just nice to be part of that wider team and working in that environment. It's rare, and hopefully it upskills me because I'll become more knowledgeable on what is available in the area, and different conditions as well. I think for me what's exciting about the role is that it's so new. So I'm one of the first contact podiatrists within my PCN and within the profession itself. So being part of developing what that looks like is exciting. Another thing that's exciting is the fact that I won't be seeing patients from just one specialism or with one foot pathology. Seeing patients across a wide demographic with lots of different complaints keeps it exciting and interesting for me. And then on top of that, the fact that it requires further education is interesting for me because that's going to keep me upskilled and continue to upskill me as things change. I'll be required to keep learning and become further educated in that way. So I find that quite exciting as well. We offer a wide range of support because we work within the wider MDT. So there's lots of different professions that we work with that we can give advice to. So we're there to provide them advice of how to get the patients to community team if it needs to go there. So for example, I've had a physiotherapist come to me and say, I've got this patient, they've got this problem, where would be the best place for them? And in that case, I will then say, okay, well, we can refer to this team because obviously I've worked in those teams before in the community. We're aware of the referral processes, the pathways and who they'll see. So we can advise them rather than, the physio passing that to a doctor who would then refer to the team or even referring to myself, we can advise them to make that direct referral. It's very varied. No day would be the same, seeing lots of patients with lots of different complaints. We would also provide general advice on footwear and foot care because the whole idea is to empower the patient to look after themselves if they can, but obviously if they can't, then that's when we would make that onward referral to secondary care.